Hi, Jeff. So
How are
just
you?
I'm doing all right. My
Good.
name's Heidi, in case you hadn't already sorted that out.
I
And I'm a writer and a marketing strategist for Mountain Rose Herbs, and I pulled the lucky straw to get to talk to you today. So,
Oh well, I don't know if you pulled the lucky straw or the short straw, and they said
oh no,
punish.
I think it's going to be worth my while. I'm excited. So,
As long as you don't feel like it was punishment, we're good.
oh no, no, no. Um,
Good.
so just as a little tiny introduction for people, I really want to give you some space at the end to talk more about Rodale and the bigger picture of what you're doing. But just as a little bit of an introduction, this is Jeff Moyer. You are the Chief Executive Officer at Rodale Institute, yes? But you
Yeah,
were for 30 years the farm manager. Is that also true?
right. I'm the chief executive officer. Prior to that, I was the executive director. Prior to that, I was the farm director, and prior to that, I was the farm manager, and prior to that, who knows?
You have spent a lot of time working with dirt, in other words.
I have spent a lot of time working in the soil, working on the farm, at home, and here at Rodale Institute.
That's a good life. Yay.
Yeah.
All right. So Rodale has been at the forefront of organic agriculture for more than 70 years, right? I mean, you guys are actually really considered to be some of the founders of the modern organic movement. Yeah.
Yeah, that's correct. We really are.
So you guys do research, you do farmer training, you do consumer education, you do a lot of those sorts of things. And you also give a lot of resources, is my understanding, for new methods like organic no-till. I guess that's not that new, but newish, and regenerative agriculture and that kind of stuff. So what is the work you're doing kind of on the bigger front with farmers who are wanting to change their practices?
Well, I think it's important to know that everything Rodale Institute does is based on science. So that's really critical because for your listeners to understand, because we're not really we're not just storytellers. We think we're pretty good storytellers, and we tell a lot of stories, and we tell stories about farmer success, and we tell stories about the work that we do. But it's the fact that those stories are based on science that gives us tremendous credibility in the farmer world. Because whether we agree or disagree, agriculture moves on the back of science, and so we have to have our science to counteract the science of the conventional programs that do have scientific research behind the work that they do. So in the organic world and the regenerative organic space, we need to have that same quality of science. So
And
it's
that
exciting
science
that
is
we do
based
that.
on some really long-term studies, is my understanding. You guys have a couple of studies that are more than 40 years running, yeah?
Yeah, our long-term farming systems trial has been in place for 40 years now. So that's quite long in the research science community. And that's important as well, because when you look at what conventional science does at the university, and we work in partnership with land grant universities all across the country, and universities in other countries as well. As we do our science, we do always do it in partnership with others. When you look at what traditional science at a land grant university will do, they'll do a 2 or 3 year study, because that's how long it takes for somebody to get a master's degree or a PhD. And so they do these 2 year studies. And that may be okay when you're looking at inputs, impacts of inputs, the relationship of inputs, uh, chemical agriculture. But when you start to look at the biology of agriculture and the biological sciences, it just takes a lot longer for those interactions to unfold. It's a little bit like looking at a child, from the age of birth to 2 years old, and saying you've determined what they're going to be like when they grow up. You don't really know. You just have to watch them grow throughout their biological life to see what they become, and how their health is, and how they interact with the community around them. So, and we need to do the same thing with soil. So when we're looking at soil microbial biomes, and what's happening in the soil, it takes time for change to happen. We can degrade soils rather quickly, and that makes sense too when you think about it. I mean, we can. It takes a long time to build a house. You can build it. Might take months. It might even take a year to build a house, and you can knock it down in before lunch, in one day. So tearing soils down is much easier, so we can degrade soils rapidly. But when you want to build that soil health back up, it takes a little bit of time. And so you have to measure it in years. So even though our experiment is 40 years old, we're still seeing dynamic change happening across the different treatments in those plots. So it is not a static or it's not a static system. It's very dynamic, and those dynamic changes take place continuously over time.
Right. Okay. That's fascinating. Thank you. And I would like to talk more about that just in general, kind of a little bit later. But here at the get-go, I'm hoping we can really start to talk about food health and nutrition, and how to kind of bring organic agriculture and more dense nutrition to families, to people who maybe don't have the ability to grow their own food for one reason or another. How we can really start people who care a lot but have no idea how to kick in here. How can we bring this to their level? So working from the understanding that the fundamental base of healthy food is healthy soil, right? I mean, that everything that our food gives us, it got from the soil. So soil health is key to human health. So would you help me understand better why there is less nutrition in our food today than there was in my grandparents' food? I read this fact that 50 years ago, we had more nutritional density in our food. Is that true?
Yeah, that's absolutely true. There's several reasons for that. Some of it, of course, has to do with the varieties of crops that we're growing. For example, if you're growing a head of broccoli and you want the head to be giant sized, you may end up with less nutrient density in that head as the broccoli plant itself dilutes that across a larger space, because it still has the same root area to mine for those nutrients, still has the root system, but you've encouraged it through plant breeding to have maybe less leaves and less foliage and a larger head. So some of that has to do with the varieties that we're planting, but a lot of it can be traced directly to the health of the soil. As we use inputs that degrade the soil and degrade biological life in the soil, we degrade that soil's ability to translocate nutrients from the soil to the crop that we're trying to grow there. So, if the plant can't make nutrients, the soil has them. We need that microbial life in the soil to mineralize the nutrients and make them available to the plant. And if they're not there, they can't do their job. So yes, the nutrient density of our foods is degrading over time to the point, and it's not just annual crops like vegetables. You look at tree fruits. I was talking with a physician a couple of months ago, and he said that to get the same amount of iron out of an apple today as you got 50 years ago, you would have to eat 26 apples. That's insanity. Nobody can eat 26 apples. And that's just one mineral, and that's iron, because it's not available to the plant. It's not stored in the apple that we're eating, and so we don't get it. Some of the work that we're doing here at the Institute looks beyond the macronutrient level and is looking at phytonutrients and amino acids. One of the amino acids that we're looking at is ergothioneine. And I would challenge all of your listeners to just sort of Google search the word ergothioneine, and don't ask me to spell that because I'm a terrible speller. But ergothioneine is an amino acid, it's a protein that's made by funguses that live in the soil. And our soil microbiologists would say I have to add certain bacteria that function like funguses in the soil. And what they do is they make ergothioneine. Ergothioneine in our diet helps the human body prevent certain neurological diseases like attention deficit disorder, autism, and Alzheimer's. You look at some of those diseases that are on the rise in our society, and it is attention deficit disorder, autism, and Alzheimer's. Well, your body can't fight off those diseases because we don't have ergothioneine in our diet. We have 30%, between 30 and 50% less ergothioneine in our diet today than we did 50 years ago. Now, part of the reason for that is we're spraying Roundup. Now, No farmer gets up in the morning, goes out to their fields to work, sprays glyphosate on the soil with the specific goal of killing off soil funguses. That's not what they're trying to do. But the fact of the matter is, there are side effects um, and byproducts to all of these materials that we put on the soil. And one of the side effects of using glyphosate to kill weeds is it also kills soil funguses. That's an unwanted side effect. And that's impacting our ability to the soil's ability to manufacture ergothioneine because we're killing off these soil funguses. Tillage can do it too. So organic farmers don't get a clean bill of health automatically because when you till the soil, you physically break up these microfilaments that the funguses produce in the soil, and that's a detriment to ergothioneine production as well. So we're beginning to look at not just the macronutrients that we might all read on the back of a label of a product, but all of the phytonutrients and the flavonoids that are created by the soil and the plant, that interaction, and that our human bodies need to function in a healthy way over a long period of time. Again, we're not talking about having people be healthy for a few weeks or a few months, but we're talking about 90 to 100 years trying to keep people healthy. And we need those material. We can't divorce ourselves from the soil in order to get those.
Wow. So I think that what you're saying to me too is that there's tillage, there's also this intent to get a higher yield, so grow bigger plants, more of something without really considering the nutrient value. So it's a big combination of decisions that we need to kind of turn around, and that's really what regenerative agriculture is about. Yes, is turning around these systems.
Yeah, we always link the word organic to the word regenerative. There's a large push across the country and around the globe, really, to disassociate those words, to try to make things easier for farmers and producers by saying, well, you don't really have to be organic. Being regenerative is actually good enough or even maybe better. It's a little disingenuous. We say you can't be regenerative unless you're first organic, because if you're trying to regenerate the health of the soil, you can't do that by putting in massive amounts of external inputs. Salt-based fertilizer is not a regenerative process in terms of soil health, nor is inputs of herbicides and pesticides to manage diseases, insects, and weeds in our soil. So we have to take that out. It's a little bit like saying you want to be an athlete, but you still want to smoke cigarettes. Well, you can say you're an athlete, but generally speaking, most people would say stop smoking and your lungs will regenerate. You can't regenerate your lungs while you're smoking cigarettes. So the same is true with the soil. You can't regenerate the health of the soil or the health of the environment around the soil by using those inputs. You can't regenerate the spirit of a farmer or the spirit of a community if you don't have financial well-being in the system. So if farmers are trapped in a farming system that devalues the commodities that they're producing, commoditizes it, and then devalues the commodity and squeezes the margins out of it, well, you can't have a healthy regenerative farmer or a healthy regenerative community, and you certainly can't regenerate the soils. So we link a couple of those words together. But if you're absolutely correct when you think about a regenerative organic system, the soil can regenerate, and that's really the positive story that we continue to tell and base it on science. Is that if we change our view of what it is we're trying to do in agriculture and focus our energy on soil health, the soil will regenerate, and we can produce a tremendous amount of volume in productivity and yield. We can produce higher quality production and yield, and we can have healthier people, a healthy environment, and we can improve the system while we do it. Because the system is based on biology, it can actually improve while we use it. If Robert Rodale, who really coined the word regenerative as it related to agriculture, would say, and he was an avid bicycle rider, he would say, when I ride my bicycle, the only thing that wears out is the bicycle. I actually get healthier. So biological systems get healthier when you use them. If you exercise them properly, rest them, water them, feed them. Of course, you have to do all of that. You can't abuse the system. But if you take all of that into consideration and focus our energy as farmers on improving the health of the soil, the crops, the livestock all come along almost as a byproduct and a free ride for the attention that we're putting on soil health.
I love that sense of the system, and I just good. So let's bring this down to kind of the personal consumer level.
Yeah.
And trying to help consumers figure out how to be supportive, particularly. I'm going to use my family as an example. So we're a family of 5. We all came out of families who really prioritize health and well-being and organics and all of that stuff. But we both had to work. We were both in school. We had 3 little kids. How do we make those kinds of choices? How do people, on limited incomes with a budget, who really believe this and want to support this, what can we do at the street level and at the home level to support this kind of good work?
Yeah, well, Heidi, we're really talking about 2 things. One is the production model, which we just talked about. And once we agree that that production model is important, then as a society, we can restructure how we focus on the economics of that production, because the 2 have to go hand in glove. Obviously, it doesn't do anybody any good if we produce this really high quality, nutritionally dense food product and no one can afford to buy it, or only a select few could afford to buy it. That's not really the solution. One of the things that I would encourage your listeners to do, and you sort of touched on it early on, you said not everybody can grow their own food. That's true, but everybody can grow something. And I would challenge your listeners to grow anything, 1 tomato plant, 1 pepper plant, 1 carrot, grow something in a flower pot on a windowsill. And what it will do is it will connect you with the soil, it will connect you with a plant, and it will connect you with your health. And it will encourage you then to ask the right questions of the grocery stores where you buy your food, or the farmer's market, or the restaurant, or wherever it is you get your food. It will challenge you to ask the right questions of our policymakers as we think about policy, governmental policy around food and food distribution. And when we start doing that, we come up with some really unique solutions. For example, here in Pennsylvania, because I believe you're in Oregon, and I'm on the other side of the country, but here in Pennsylvania, we worked with our state to get what we call double SNAP. A lot of our customers and consumers, it doesn't matter where you are on the economic spectrum, everybody wants their family to be healthy and to eat high quality, healthy food. So you should not be sort of disadvantaged from that simply because you're either permanently or temporarily on the lower end of the economic spectrum. And so if you're purchasing your food in Pennsylvania with SNAP dollars, the government assistance program, food stamps, we can actually, you get organic food at half price. Makes it very reasonable. Now that's something the government can step in and do. We could do that in every state. We can do that at the federal level and say, look, it's important that we do that. We could do that with institutional buying. If school districts were encouraged through tax incentives or rebates or reimbursement to say, look, we want to put these food products in our school. We want to put a vending machine with organic fruit in it right next to the Coca-Cola vending machine, or Pepsi, or pick anything you want, not to pick on any one soft drink company. We're not suggesting that they don't have to be in the schools. There are students who probably want that selection, but there are other students who would push those buttons and get the organic apple. How do we encourage institutional buying to do that? We know that can happen. We work with a local hospital here in our valley, St. Luke's, Anderson campus, their hospital. What happened at Anderson campus was it was an inner city hospital. They wanted to grow and expand. So in order to do that, they had to move outside the city limits where they could buy some land and build a new hospital building. And they bought 500 acres and they built their hospital. And I believe they were left over with 300 or 400 acres of additional land that wasn't being used at the moment. It's future expansion or whatever. And so they rented it out to a farmer. Well, that farmer farmed it conventionally. When they started spraying pesticides in the spring, the hospital administrator said, what do I smell? What's going on? Facilities people go, oh, well, that's pesticides. They said, but we're a health organization. That doesn't sort of, so they called Rodale Institute. And we don't manage the entire farm, but we have I think it's an 11-acre farm right now on hospital grounds that is certified organic. All the food that we produce goes directly into the hospital catering system and ends up on patients' plates. It allows them to tell the story. And in fact, if you go to their website, it's kind of clever. I don't know if it says it today, but it used to say, if you don't come for the medical treatment, come for the food. Now, what hospital says that? Because they're serving organic food in season. You can literally see the farm from the hospital, depending on what floor you're on. As a patient, you can look out your window and see an organic farm. That's telling a story about human health and the connection to the soil. There isn't a hospital in the country that should not have their own organic farm. Even if they're not, obviously they're not producing everything that the hospital uses on 11 acres, but it's enough that we can tell the story. And whenever our food becomes from the farm into the hospital, their salad bar sales triple. The food sales just go off the chart as everybody goes, why wouldn't I want that? Well, now the hospital staff wants CSA shares. So the farm grows CSA shares. This year, we're going to be expanding to a fruit farm. So there'll be fruit in there. But getting back to your initial question, double snap is one way that we can do that. The other thing that we can do is we can incentivize CSA shares. We have a program that's called ASC instead of CSA. It's Agriculture Supporting Communities, and we go into underprivileged communities and we get grants to produce the food and sell it to consumers at a discount. So they get their CSA shares at a lower cost than someone else would. And these are all, and we have recipes, and we can produce those recipes in multiple languages. So we can have them in Spanish, so people can, if they relate to the language and the food that way. What's really fun is you start to get responses from people, and we can grow specific foods that they want. So if there's a certain peppers that people want, or potatoes, or tomatoes that somebody is used to growing, and they request that, growing tomatoes for our staff is growing tomatoes, so we'll grow what people want. So we almost become custom growers for low-income people. Why not? I mean, they deserve that, and we can do that. The other thing that I would suggest for your family of 5 is to begin to prioritize which food items you buy as organic. You may not be able to buy the entire spectrum. So maybe you say, well, I'm not going to buy expensive organic toothpaste. I don't want to pick on toothpaste, or pet food, or maybe snack foods, because they could tend to be maybe more expensive. But I'm going to focus on those staples, or the things that my family eats a lot of. If you have young children and they're drinking a lot of milk, or putting milk on breakfast cereal, maybe you're going to start with organic milk.
That's where we started, for sure. Yeah.
Maybe you're going to start and say, well, we eat a lot of chicken, and I want to get the hormones out of the meat in my family. I'm going to start with organic chicken. Maybe you say, I'm not going to buy as much high-end beef. If I'm buying beef, I'm going to buy hamburger. And I can do a lot with that. And I can buy organic hamburger for the same price as I pay for conventional roast or steak. So you're going to downgrade a little bit, but you're going to upgrade the quality. We have a farmer here in Pennsylvania who takes all of his high-end cuts of beef, and he sells them to expensive restaurants. It's all organic. They buy it, they pay for it. He said, can people in my community afford that? No, they can't. But because they pay so much at the restaurant for my high-end cuts, I literally take my low-end cuts, sell them at a discount off the porch of my house, out of my freezer, and the hamburger I donate to a homeless shelter. So even homeless people are eating organic beef. Are they getting filet mignon? No, they're not. But it's the same quality meat and the same health to them. And so there's things that we can do as individual farmers, as government agencies, as purchasers, as with our philanthropic dollars, to help drive that market. And if we decide that that's important to us, we can put those foods that are most important to people onto their plates as an organic version at an affordable price a price point they can meet. Like I said, maybe not for everything, but certainly for those staples. I suggest fruit.
So I think what you're saying here too is that ways that people kind of at home can start to do this is, I really love the idea of grow something. And I really want to come back to some of the resources that Rodale offers on your website for vertical gardening. And you guys have this wonderful grow tower that I'm going to build in my yard. So it's just really fun stuff. But also looking for CSAs. And even within city situations, there's often CSA options that come in, right? And then, but also, where people begin to start to put some pressure, let's say, on their local government or whatever, when you're talking about the double snap and you're talking about these resources that Rodale has been so helpful in putting into place, how do people, what are the right alleys? Can they get a hold of Rodale to get some ideas? Are there, how do they start it? If you're in St. Louis or you're in Portland, Oregon, you know, where are those resources? Where do people begin to find that CSA or that, you know, I mean, I have some ideas here, but I don't know if I have a sense of, you know, nationally what that would look like.
Well, certainly Rodale Institute is a resource, and we would welcome anyone to contact us, and we'll help any way we can. Sometimes it's easier if local people reach out to their local government. You know, your local state representative who lives, works, and communes in your community. Talk to them. Tell them what's interesting to you. Tell them to reach out to Rodale Institute. Tell them to reach out to, and we'll help steer them and say, here's how we did it in Pennsylvania, or here's how we did it in Georgia. And you can do it too if you're really interested. Here in Pennsylvania, we created, our governor created it. We have currently we have a Democratic governor, and we have Republican House and Senate. The representatives and the senators are very conservative here in Pennsylvania, and our governor, I wouldn't say he's very liberal, but he was really interested in creating a state farm bill. We have a federal farm bill that all of us as taxpayers pay into, and that's what controls SNAP dollars and many of the government programs that go out to farmers. But we wanted to have a state program. We talked with our governor, and we got one of our pillars in our state farm bill to be transitioned to organic. Not because it's good for people's health, not because it improves the environment. We weren't even really weren't allowed to talk about any of those things because it's sort of said if it's really good for human health, it would infer that conventional food is not, and we weren't allowed to really say that. But what we said is economically, it's good for farmers. Farmers can make a better profit when they're farming organically, and it was on profit alone that we were able to steer government funds. Now that we had that done, then we said, well, how can people buy this? Well, then double snap worked really well. So it can work across either side of the aisle, and but it all starts with talking with your local representatives and tell them what's important to you. I would love for my students to have an organic choice in the cafeteria. We're not saying everything has to be organic. We're saying, maybe let's start with fruit, because fruit does use a lot of pesticides to produce. You have a lot of organic fruit in Oregon and Washington. It's not that far away. And just say, we just want to get this local organic fruit into our school systems. That can have a huge impact at the college level. Institutional buying is just so huge, and they can move a lot of acres and a lot of dollars all in one big swoop. There's hardly a university that doesn't have some organic options today, and that's because students are asking for it. So you literally have to ask for it. If you don't, it won't show up. And we're not suggesting that you downplay what's already there. People have choices. You're asking for another choice. If your supermarket begins to handle more organic food products and it doesn't sell, it won't last, because they have to pay for shelf space and floor space, and they have expenses too. If it sells, they'll get more of it. And so people get what they ask for and what they want. So you really just have to put up your hand and say, this is important to me. How do I do that? Our local, we did a program here on the East Coast with some large supermarket vendors, and they said it takes 6 people to impact what's on a grocer's shelf. 6. If 6 people come in and ask for something, their buyers will find it, because they've got some algorithm that they put it through, and it basically works out to, for every person that takes time out of their busy day to ask for the produce manager, to have that produce manager come out and have a conversation with them, they anticipate there's at least 100 people that would want the same thing. They just don't have the time or the energy to ask. So what they said is, you get 5 of your family members, try not to all dress the same, and go in there and ask them to, and they'll start to click and say, hey, we're being asked for this. We should have it on our shelves, because they're in the business of making money and selling people the products that they want. If everybody says, there's a reason potato chips are on the end cap, because people ask for them and want them convenient. and there they are. But if we ask for organic fruit to be there, it would be there too. So they're just in the business of selling food, and we can make some changes, but as individuals, we have to step up and take that on to ourselves.
So I really want to keep thinking about the positive on this, but I had read a thing that I wanted to ask you about. Can you talk about how we're seeing massive amounts of, as you talked about, we're seeing all kinds of health issues. We're seeing a lot of obesity, we're seeing a lot of diabetes. We're also starting to see some antibiotic resistance. And how does that relate then to our food system?
Yeah, food and lifestyle has a huge impact on our health and on non-communicable diseases like diabetes, or obesity, and even heart disease to some extent. And we can manage that so much better with lifestyle and food intake than we can with pharmaceuticals. There's a hospital system in Pennsylvania, and I'll come back to Pennsylvania mainly because I have some good firsthand experience there, and it's called the Geisinger Institute. And I would challenge you or your listeners to look up the Geisinger program. What Geisinger did was they took a population of low income diabetic people and they literally gave them for free organic food and nutritionally dense food. What they found was that if they gave them $2,200 worth of food in a year, they saved the hospital system $20,000. Now, that's an investment anybody will make. If you can save $10, I think they said average over the multiple years, $7 to $10. So let's just pick the low number, $7. If you can invest $1 and get 7 in return, there isn't an investor in the world that wouldn't snatch that up in a moment. So why don't we have government programs that look at that science and say, how do we get involved with that? How can we save Medicare and Medicaid dollars in a 7-to-1 ratio? It's with the food that we eat. Now, we're not suggesting that everybody get free food. The farmers were paid for the food. The hospital said it's to our advantage to give them the food for free. And they have what they call a pharmacy, which is spelled with an F instead of a PH. And the patients actually get a script from their doctor for organic food. They take it to the pharmacy, they hand it in, and they get organic food instead of medication. And their blood pressure went down. Their diabetes levels went down. They lost weight. When you start to lose weight, you naturally want to be more active. So they started exercising. They didn't have to be told to exercise. People just feel more like exercising, or at least getting out and being active as they can move around better. And so they saw, no matter what metric they looked at, people's health was improving much more dramatically than it was when they were sold pharmaceuticals. So that's a fun study to look at. It's out there, and
It's the Geisinger, you said, program?
yeah, it's spelled a little funny. Geisinger is spelled Geissinger. And if you would just look up Geisinger's Fresh Food Pharmacy, you'll find their report and their studies out there. It's been over probably the last, I think they started in 2014 or something. They started with that study, and there's been a lot of great information out there about that. It allows the hospital to work with local food producers to produce food for that. So local food growers can benefit from that as well. Everybody, but the soil health benefits, the community benefits. It's a very regenerative process.
That's beautiful. That's great. Well, all right. So I just said I want to be sure and leave you some time because I'd love for you to just talk about Rodale and what you'd like us to know and how people can kind of support Rodale the best way and more about that. But I did want to just, because I had brought this up, I am an avid urban gardener and I don't have very much land. So I'm always super excited when I find intensive ways to grow organically. And so I just wanted to encourage listeners and readers to just know that Rodale also has some beautiful plans that you can go on the site. They have wonderful resources that you can get these plans to build things that will allow you to grow much more food in a tiny space. So from my personal perspective, that's also really a wonderful resource. So, but will you spend some time and tell What is going on now? What are you finding? What's exciting?
Oh, well, so many things are going on. Of course, on the science side, we have dozens of projects here at our main campus, but we're also expanding and branching out to other campuses around the country. We now operate on 8 campuses across the country. So we have a small research facility in Ventura, California. We have a research facility in Cedar Rapids, Iowa, and we have a research facility in Chattahoochee Hills, Georgia. So we've got out of state facilities. We have multiple facilities within the state of Pennsylvania that are looking at research. So, if somebody wants to get out and visit, if they're from one of those areas, it's a little more convenient for them to get out and visit those locations. That'd be great. All of them have field day events or activities that take place where you can get out and meet farmers and growers from that community and interact with them or other buyers that might be more like yourself or myself. So that's exciting to us. Um, as we look at farmers in transition, there's a couple of things that take place. First, we see that the organic industry is growing rapidly on a global basis and within the United States. But in order for farmers to take advantage of that growth in the market, they really need to be incentivized and they need to have tools that allow them to break down the barriers to adoption of new practices and principles. Most of the farming is, by its very nature, a very capital intensive system. So it takes a lot of machinery or equipment and labor and packaging and washing and all those facilities. It can be quite daunting when you look at how much money a farmer may have invested into their infrastructure, and to try to take that infrastructure and change it to a new production model can be challenging. So Rodale Institute has been working with several partners to create mechanisms that allow us to help them. So 2 years ago, we started an on-farm consulting firm. So we literally can take a consultant from Rodale Institute and put it in a farm office or a home kitchen for people who want to transition to organic, and coach them and mentor them through the process for farmers. So that's an exciting new venture for Rodale that we've never done in the past. Here in Pennsylvania, because we had our Pennsylvania Farm Bill, we were able to get funds through the State Department of Agriculture. And in Pennsylvania, we can put that consultant in a farm office or home kitchen for free. That's really nice. So there's no fee structure at all for farmers. And that's because, again, our government agencies looking at it said it's beneficial for the state, for the people of Pennsylvania, if we can grow more organic food. And we need to give farmers the tools they need. And part of the tool is education and knowledge. And so we can walk people through that process. Now, some farmers need a great deal of hand holding and some need very little hand holding. It just depends where they are on the management spectrum or the knowledge literacy curve around organic principles and organic certification. But we can walk people through the entire process, everything from getting certified to developing crop rotations, weed management programs, and in some cases, even marketing. We're building relationships with organizations that are marketing people and logistics people, and they'll take the product. In Georgia, for example, working with Emory University. Emory is probably the largest single institutional buyer in the state of Georgia, and they have guaranteed that every farm we transition to organic, they will buy 100% of their product. So now, if you want to transition to organic, we have a consultant to help you through the paperwork, help you design the system, and we have a guaranteed market for the product. Now, we don't guarantee price. That's not what Rodale does. We're not buyers ourselves, but that's something they would negotiate with Emory. We're working in the Midwest with Cargill. And some people say, oh, why is Rodale working with Cargill? Well, Cargill is one of the largest logistics grain managers in the world. They know how to truck grain, store grain, and process it into feed. Chicken farmers who are farming organic poultry don't raise their own feed. They have to buy it. The chicken processors own chickens and chicken houses, but they don't have feed mills, so they depend on the feed industry. So we're working with a large-scale buyer here in Pennsylvania, Bell and Evans Organic Chicken, and Cargill, and we're transitioning thousands and thousands of acres of grain to organic from conventional because we're able to supply a consultant on their farm, a logistics manager, and a buyer for the feed at the other end, and we can offer 5-year contracts. So a grower knows that once they're organic for at least the next 5 years, they're guaranteed a market for their product. And those are the kinds of incentives we need to create on a national basis to get more and more product and help farmers do what we want them to do.
And you also work with small scale farmers, right? And you work
Of
with
course.
all sizes.
Yeah, we are scale neutral. We work with small farms. Even our consulting program here in Pennsylvania. I mean, we've been on farms that are teeny tiny and a quarter of an acre, and we've been farms that are thousands of acres. It doesn't matter to us. We want to transition every acre of land in the world to a regenerative organic system, and we were trying to put tools to work to do that. Of course, in some cases, we're using government money. In some cases, philanthropic money. In other cases, we try to be as creative as we can. But yeah, scale isn't really important to us. It's getting people's minds changed around what it is they want out of their food system. If what we want is the cheapest food we could possibly get at any cost to the environment, the ecology, or our own personal health, then that's the food system we're going to get. If, on the other hand, we say we want, right, that's what we have now, because we've said we want that food as cheap as it can be at any cost. I think that's wrong. We should be saying we want a healthy food system at a cost a cost point we can afford, and how do we do that? That's a different question than what we've asked before. And if we ask farmers to produce high quality food at a reasonable price, they will do it for us because they always do. Whatever it is they need to do. They're very resourceful and energetic and creative and hardworking, and farmers all across this country and around the world get up every day with the sole intent of feeding people. No farmer gets up and says, I want to destroy the health of my soil. Yet they're incentivized to do that because we've taken away their ability to do anything other than that. And we have to give them that power back. So Rodale works, again, at all scales and with consumers to try to create more consumer demand. Here in the United States, we consume about roughly 50% of the organic products the world creates, but we have less than 1% of our farmland is organic, even though 6% of the food, depending on the category, it's up to 14-20%, is produced.
Say that to me one more time.
Sure.
Did you just say to me that in the United States we eat 50% of the organic food produced in the world?
Yeah. We're net importers. We export conventional food and import organic food. And so we're saying, why wouldn't we produce more organic here? Our domestic production lags consumption tremendously. About on a whole, if you take the entire diet, about 6% of the U.S. diet is organic, but only 1% of the farmland is organic. That means we're importing. We're importing globally. The organic food world is in excess of 100 billion, and about 55 billion of it is in the United States. So we're spending a lot of money on organic food, but a lot of it is being imported. And we're suggesting here at Rodale Institute that a lot more of it could be and should be produced domestically. And we can do that if we incentivize our farmers and encourage them to do what it is we're doing. Now, keep in mind, if you look at, and again, it's not just the United States, it's a global problem. We have about 6 times as many farmers over the age of 65 as we have under the age of 35. So we have an aging farm population. The average age of a farmer is creeping up slowly towards 60. If you belong to a club and everybody is over 65 and you're the only one under 35, you're probably going to be the last person there turning on and off the lights, So it's good and it's bad. The positive side is we know that the land is going to continue to be farmed. And we know that in the next 20 years, over half the farmland in the United States is going to change management. There's a huge opportunity there for change. We know that younger farmers coming on board wanting to farm don't want to do exactly what their father or grandfather did. They have an opportunity. If we allow them to express that, and if we encourage them with economic incentives to follow their desire and change the production system and create a more regenerative organic model, they will, and we will all benefit. If we discourage them from that and don't incentivize it, we could end up with just a continuation of the same thing, and that would be, I think, a missed opportunity for all of us.
Thank you for that. We're about at time, but I just am so glad that I got to have this conversation with you, and it gives me hope about what we can do. And
yeah, and at the very least, I mean, of course, my development team would be aghast if I didn't say we do operate as a 501c3, and if people want to donate, like what they heard, and want to support the work of Rodale Institute, please do that. If you can't do that, if you're not in a financial position to do that, we certainly understand that. Go out and buy something organic. Support local organic farmers. If you have the opportunity and are able to do that, please do that. When you're at the supermarket, buy something organic. Begin to look for the regenerative organic seal. That's a new certification that's coming out that Rodale Institute helped start, along with some major brands in the industry, to add in the pillars, not just of getting pesticides out of our system, but to begin to look at the issues of animal welfare, social justice, and soil health. All values that consumers and customers come to the marketplace with, and we're packaging those all into one label now. So regenerative organic certification, look for that, support that if you can. Even if you just read about it and share the story with your friends and neighbors, so everybody begins to think about it, talk about it, have a conversation, talk to your congressman, talk to your senators, make this a priority item for you, because it really comes down to our own personal health. We can impact our personal health by talking to our congressman, not our doctor, by talking to a farmer, not our physician. Change the way we do things, and we will improve ourselves tremendously. Not that we have anything against physicians and pharmacists. We'll always need them in our communities and in our lives, but we shouldn't rely on them as our first line of defense. We should really think about our first line of offense, where we take personal control over our lives and our health situation and try to improve it.
Perfect. That's absolutely perfect. And I want to say how honored Mountain Reserves is that we get to support Rodale and the work you do. And my family supports Rodale, and we're really, really glad that you're out there doing this hard work for us. So thank you.
Oh, it's our privilege and pleasure and a blessing every day to be able to get up and do that. And we value your support, individual support, corporate support, of course. We know everybody works really hard for the money that they have. And when they allow us to be able to interact with them and take some of those resources and put them to work, it's a privilege to do it.